Hey folks, so you're trying to figure out how to get your staff to get excited, to be interested, to do better when it comes to dementia care. But how do you do that? Well, one way to get started is to think about what are they aware of and what are they not aware of? Do they get dementia? Do they get the basics? Do they understand in some fashion or form that frequently what gets people upset when they have dementia is our effort to give care? Because many people have been trained as caregivers and they're good caregivers, but when it comes to dementia, it's not about giving care, it's about forming a relationship so that the tasks that we want to get done can get done without getting the person we're trying to help all upset and distressed. So how do you get started? Well, maybe starting with a couple of videos. One, to increase your awareness of the disease and the condition called dementia and what happens to people's brains when it happens. And then what are some things we could do differently that might help? So the two DVDs are called Dementia Care Provision, and then PAC skills, or positive approach to care skills, make a difference. And when you add them together, things can shift and change. It's not going to change the culture without some more work, but at least you know people have seen and heard and maybe even thought about what happens when they try to help and their help is not accepted. What happens when what they're trying to do seems like not what the person wants them to do? What happens when the person is trying to communicate in a way that's irritating or frustrating or doesn't make any sense? And yet it's really important we get the message. So we have then this combo that we're offering to give you a different way, a better way maybe of putting the puzzle together to get people on the bus. Doesn't mean you're getting where you want to be entirely, but it's a great way to start. Try it, see what you think. You're trying to make a difference and so are we. So one mind at a time, but it starts with what you see, hear, and then what you choose to do. Thanks, everybody.